Washing my hands. Knock, knock, knock. May I come in? Hi, Mr. Black. My name's Jocelyn. I'm your student nurse assistant today. May I check your ID band, please? Thank you, Roger Black. I'm here to feed you lunch this afternoon. Is that okay with you? Great. Before I go get your tray, I'm just going to go ahead and set up some of my supplies. I'm going to go ahead and clean your bedside table with this paper towel. I'm going to throw that away. And then I'm going to go ahead and clean your hands before I serve you your lunch. Can I see your right hand, please? I'll go ahead and support it. Our patient is right-sided paralyzed. All right, go ahead and set that off to the side. All right, Mr. Black, I'm just going to go grab your tray. Here's your call light if you need anything. I'm going to wash my hands, exit the room. I'm going to come and make sure I select the correct tray. It says Roger Black. That's his. Those are his diagnoses. If I go back to the diet card, that's what I'm checking for. He's on a full clear liquid diet for 24 hours, and his allergies are penicillin. His food, I need to remove the pizza. I need to remove the grapes because those are not clear liquid. Everything else is okay. I'm going to go ahead and take this to Mr. Black, wash my hands, knock, knock, knock. Hi, Mr. Black. I'm back with your lunch. I'm going to go ahead and set this down. Did you want to eat lunch with your curtains open or closed today? Curtains open. Okay, sounds good. Before I serve you, Mr. Black, I'm going to just want to ensure that I have the correct tray. I need to check the diet card with your ID band. It says it matches. Good. I'm going to go ahead and put a clothing protector on you, Mr. Black. It's just to protect your clothing. I don't want to get them dirty. You hungry this afternoon, Mr. Black? Says yes. Okay. I'm going to go ahead and get a chair next to you. Your patient is right-sided paralyzed, and we want to make sure we're sitting on their strong side. So go ahead and move the tray to face you. Is it facing you? Okay. You're going to first test the tray against your wrist just to make sure it's not too hot, not too cold. It's a good temperature. You're going to test the liquids. Just put it underneath your wrist. Okay. Good temperature. Good temperature. All right, Mr. Black, did you want to try feeding yourself some of this good soup? Patient says no. All right, so you're going to go ahead and start feeding your patient. I'm going to pretend like it's staying open. All right. Is it good? Give your patient time. All right. Did you want something to drink, Mr. Black? Says yes. Go ahead and hand your patient, give them. Did you want to try giving yourself something to drink? Patient says no. Wants another drink of water. Okay, go ahead and continue to feed your patient. All right. Patient has ate all their food. They ate all their soup. They had all their soup, which is 1 cup. They drank all their water, which is 8 ounces, and they drank all their tea, which is 8 ounces. So 8 ounces is 240, so 240, 240, and 240 is 720, so I would document that. Mr. Black, I'm all done serving you your lunch. Is there anything else I can do for you? They say no. Okay, I'm going to go ahead and remove your linen protector from your chest. And you're going to dry their mouth with the linen protector just in case they had anything on their mouth. You'll put that in the dirty linen bag. I'm going to go ahead and hold on to, I'm going to go ahead and clean your hands, Mr. Black, before I take your tray. Put that in the dirty linen bag. Go ahead and hold the tray up, and then you're going to clean the bedside table with the paper towel. And then you'll throw that away. I'm just gonna go ahead and take your tray, Mr. Back, and I'll be right back. So you wash your hands, exit the room, you document that your patient had 720 cc's of liquid in, and then, all right, Mr. Back, I'm back. I'm gonna go ahead and put away my supplies. So your dirty linen, your trash, just put those away. I'm going to go ahead and check for body alignment. You're in a good position, 90, 90, 90. I'm going to go ahead and leave you in a sitting position, Mr. Black, just to help you digest your food and just keep you in this position for about 30 minutes. I'll be back later to check on you. Is there anything else you need before I leave? Patient says no. Okay, here's your call light, Mr. Jones, and I'll be back later to check on you. Call light, Mr. Jones. I'll be back later to check on you. Wash my hands. Exit the room. I'm going to report, record, and recheck.